founding chairman, Professor Banskota, is pioneer for bringing a club food program in Nepal. And but initially it was till 2004, the more cases were had to go through a surgical intervention. We had more than 90% of the cases who had to go through major reconstructive surgeries for the club foot treatment. But our Professor Banskota met Dr. Ponsetti, who is the pioneer for the Ponsetti technique in 2004, and now there is a paradigm shift in the treatment technique of the club foot cases since 2014. Now, where we had a 90% of the surgeries, now just 8 to 10% of the cases delay presenter had to go through the surgical intervention. So if you look at the graph, every day our the graph is going up. The number of cases we treat is going high every year. So far, more than 10,000 cases of the club foot have been treated. And I must thank again to Miracle Feed because of the partnership with Miracle Feed since 2015. Our program has boosted, and we have been able to provide the club food services in a more, organized way from since 2015. So again, thank you so much to Miracle Feed, and with the partnership from Miracle Feed, we have already solved about 4,000 cases with the club food. Again, a beautiful example to illustrate how important is Miracle Feed for us, how important is this partner for us. This the lady was born with club foot, but for some reason she was left untreated. But and again, most of the time, if a lady has disability, they would not get married. If they get married, they would get married to a boy who is more disabled. So she got married to another boy who is deaf and dumb. And they were so poor. The husband used to take all the buffaloes from the village and take the buffaloes to graze, and at the end of the day, the buffalo owners used to give them some cups of rice, and that was their meal. So later on, they gave a birth to again a child with club foot. The lady, just imagine, the lady had gone through lots of social stigma, lots of social trauma throughout their life, and the same lady gave birth to another child with club foot. So, what would be the mental status of that lady? You must have imagined that my child again had to suffer a lot that I used to suffer in my life. So fortunately, again we were able to identify this little boy, and eventually the foot is corrected. And this is all because of the good partnership with the Miracle Feed. And they are living a very happy life. We are actually sponsoring this little kids, education. And I was told that this little boy walked confidently in a village for the very first time in his life, because before the treatment there was lots of social stigmas attached with it. So it was his first walk, and we also supported this family for the livelihood. We bought some cart, and she used to sell some kids and chutpati jugul time. So and she started around making around $6 a day. So I was talking about our decentralized service. We have 7 provinces in our country, and we have already reached to 5 of them through our through the partnership from Miracle Feed. And in the last year, 2024, we opened one new outreach clinic, and this decentralized service not only helps us to track the new cases, it also helps in reduces the dropouts, casting dropouts, tracing dropouts. So again, thank you to Miracle Feed because of, and this is our new approach. We have reached to unreached area. So do it. It's a Nike, but for us, it is like Department of Innovative Thinking. COVID was a very challenging time for all of us. It was very difficult for our patients to come to us to change their caste, but it was a little bit easier for us because we had a hospital tag. So it was easier for us to reach to them. So our casting materials used to carry our casting materials, cast provider used to carry all the casting materials in their motorbikes, and they went to the doors. Sometimes we used to change their cast in a cow shed, sometimes in an open space, and it has worked very well. So I would say mobile phone city is one of our best practices, and it is still continued. And we have our own orthotic and prosthetic lab for the manufacture of the club shoe. So this is our best practices, I would say. If you look at the target versus achievement, we have in the last fiscal year we have achieved 101%, and in the current running fiscal year we have for the 2 quarters we have already achieved 105% of the targets. If I compare my data with the global benchmark, in all of the KPIs we are doing very good, except the first visit at 12 months. The reason behind it is, we have to do everything by ourselves. The government is, I have to say this, our government is least bothered about the disability, about the club food programs. So whatever we have to do by ourselves. Club food program is not integrated into the government system. So we have to go to the doorstep to identify them, bring them here, for the treatment, send them back, and there are lots of social stigmas. So, but we are doing lots and lots to,